Hello everybody, welcome back to my channel. Today we want to talk and kind of review about certain right that the client may have, regardless they are inpatient or outpatient. So as they are consumer, but the consumer also has some right. We have to deliver a lot of information to the mental health advocate, and as a mental health provider, we also need to pay attention and understanding what they really need. So let's begin to review their right. And today I'm just gonna go over some very general rules in terms inpatient, outpatient. So let's gather some information and summarize what their rights are. So of course, they need to be treated with respect and dignity, regardless their status, their mental health disorder, mental health issue. So we have to pretty much treat them with dignity and respect, and their privacy need to be honored. We need to understand their privacy. We need to understand their need in terms of their mental health. We also need to care their plan, develop their need, and then understand what type of service that they need in order to continue to live independent in the community. And they do have a right to participate in the certain decision-making skill in terms of their right, in terms of their mental illness, whatever that is. They also can request information about their name, location, their phone, their language, and it depending if they are multilingual, if they have a multiple language barrier, then we need to provide certain language for them to continue to understand how their treatment plan is. And they should receive the amount of duration of a service they need. If they require additional service and additional amount of the time that they want to spend with you, then you do need to kind of understand, what they're coming from. Their required information is also needed when it comes to certain degree when we talk about, there's certain connection if they want to be referred to a different agency, if they want to be referred to a different service, then we need to be able to provide those type of service. They're also free from restraint, at least that the 5150 is needed. So if the 5150 is not needed at that moment, and you cannot restrain a client, even in the outpatient setting, or if they're going to a psychiatric hospital, that would be a different story. So if they kind of went to a psychiatric hospital, then the psychiatric unit and emergency unit will be able to perform 5150. They do have a right to request a copy of information. They do have a right to talking to their immediate family, if possible, but make sure that release information is there. They do have a right to from free of obstacle with certain type of sexual harassment. That's important. It's not just required to the employee, but if there's an issue with client to client, there's a sexual harassment between client to client, you do need to step in and then help them to go through the appropriate department or procedure to resolve the issue. That will be something that we can discuss in the next couple of YouTube. They do have a right to file grievances, the paperwork to complain about your service. They do have a right to request for the administrative fair hearing from the court. In case if they go through a certain issue, the other individual, they can go to the court, attending those type of service with an interpreter. They can get a free lawyer to help them with cases. There is a lot of things that we can talk about it today, but I just feel like that's pretty much for now for today's channel. So I may do the other additional about the client's right in terms of the inpatient, outpatient issue. Their right is greatly, we respect their right, and we kind of respect what they go through as a mental health consumer. So as a mental health provider, you do need to provide those type of service on a daily basis. You need to follow through all those procedures, to make sure that you kind of understand what you need to do and what the client want you to advocating for you to do certain things. So that will be for today's channel. If you do have any question, concern, feel free to shoot me a message, and then we'll be seeing each other again.